Duane Williams. I'm the president of LifeSavers. Our goal is to save lives where people may not have originally thought they had an issue. I've been a vascular tech for 26 years. I started out in the Baylor Hospital system, worked there for 8.5 years, moved into what I like to call the private practice, working for a cardiologist at first for a few years. Then I moved and pretty much for the rest of my career worked for vascular surgeons, being trained by vascular surgeons, going to the grand rounds with the residents and learning the business basically like as a resident or an intern would from the ground up. I got my initial training working in the hospital system, and I felt really blessed to work for vascular surgeons and lead techs that were very hands-on and gave me the direction I thought I needed to go. From there, I went on into private practice, and I ran 3 or 4 different labs as a technical director. For the last 20 years, I've ran labs, I've made them more efficient. I've tried to train people and help them reach their potential in their abilities. And as I was taught, sometimes you have to look beyond the obvious. You have to see, sure, there's not a blockage where you're looking, but the flow is behaving a certain way. So you have to recognize that and keep those things in mind. So when you find an issue like that, you know how to report it to the physician so they can backtrack it and run a further test that might be like a CT or an MRI, and then they can identify the area where the problem is. And this is where my expertise lies in the experience of 26 years and working in these fields and practices. I've helped many doctors who weren't trained as well as I and made their practices where they might have only been doing so many patients to where we grew it, where we tripled or quadrupled their practice. And people ask what I do. It's like I'm a vascular tech. I work with the pipes, not the pump. So I like to differentiate myself from heart techs. I see us as colleagues where there's specialists in the heart, but I really look at the circulation. We do all the circulation in the whole body except for the head. We really like to focus on stroke prevention, aortic aneurysms. They can rupture. They call aortic aneurysms a silent killer because they can just happen. I always like to point out that John Ritter died of an aortic aneurysm, ruptured when he was 44 years, had no clue. So this is what we really like to bring to the forefront and teach people these things are very real threats. We specialize in a wide variety of circulation issues. I consider myself a specialist in the venous circulation. This is the blood flow that has to return back to the lungs, expel the CO2, and pick up new oxygen and start all over again. The problems we develop with that are varicose veins. And from that, you can have ulcers, leg swelling. There's a myriad of problems that occur from the venous system. It's really a lot of people confuse the venous and arteries. The veins take the deoxygenated blood back to the lungs. The arteries drive the oxygenated blood from the heart to all the tissues and organs. And for there, we look for stroke prevention, for arterial blockages, diabetic control. When you have hardening of the arteries, your blood don't flow as well because the arteries are very integral in expanding and contracting and pumping the blood on. The heart isn't the only mechanism that pushes the blood throughout the system. The arteries have to expand and contract and push it on. And in my view, all of these things can give people a quality of life far beyond what they thought they could have if they focused on these issues and getting the screenings that we provide, be it to student athletes, firefighters, or senior citizens in their independent living facilities. We expect that we could extend their lives and their quality of life by a good amount. My name's Duane Williams. I'm the president of LifeSavers Preventative Screenings. And we appreciate you taking the time to look at these videos. And we hope that we can inspire any one of you to get a screening and embrace the quality of your life.